or connect with us on social media.
A province-wide stay-at-home order is currently in effect. Limit trips outside the home. Remain in your local community and work from home if you are able. Visit the province's website for more information.
Looking for the best way to get the Major League Baseball games you want to watch? Rogers Super Sports Pack has you covered. With MLB Extra Innings, you'll have a premium ticket to out-of-market regular season games with all games available in HD. Don't miss the action from the games you want from both the American and National Leagues. MLB Extra Innings, part of the Super Sports Pack. For only $35.95 a month, Rogers customers get all this for one all-inclusive price. Order using your remote starting on channel 431 or visit Rogers.com today.
You're watching Rogers TV.
Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guest to the program today, I'd like to share a few thoughts with you. We are at a critical point in our ability to contain the spread of COVID-19 and to protect our residents. Our hospitals in Grey Bruce are admitting very sick COVID-19 patients to the ICU beds, and our healthcare system in Ontario is being stretched to its limits. Hospital beds and ventilators are not an endless supply, and no one wants to think about what might happen should all of those beds and ventilators be in use and more very sick patients arrive and needing this specialized care. Our Grey Bruce Health Unit, as the leading agency for the management of the COVID-19 emergency, cannot do this alone. They need our help. They need, and in fact are pleading for us to work together with them. We can all agree that we want to make this lockdown the very last one we will have to go through. Follow the provincial stay-at-home order by not going out except for absolutely essential travel. If you have any possible COVID-19 symptoms, go to the assessment clinics for testing. Be open and transparent about the people that you may have been in contact with. This might actually save their life and those of others. The Grey Bruce Health Unit asks the public to continue with the 3 W's. Watch your distance, wear a mask, wash your hands. This journey has been long, and we are all weary. The sacrifices we continue to make each and every day will bring all of us closer to the finish line. Let's make the difference together. Thank you to our community who continue to fight against the COVID-19 pandemic in every way possible. And on that note, I also want to welcome our guests and thank you for being on the program as well. So I have with me today Barb Fedy and also Elizabeth Brims, and we're going to be talking about the social assistance transformation and some of the things that have happened as a result of COVID-19 to social assistance. So welcome to both of you. We were joking before the program that I'm going to be turning it over to both of you, and I'll sit back and let you have a roll for 28 minutes. I'm wondering if you could please just say what your role is and then take us through the transformation, including why it's necessary and what you hope to achieve. So who wants to go first?
I can start, Carol. So thank
Great.
you very much for the invitation to join you today. We were excited to receive that invite. I'm Barb Fedy, as you noted, and I'm the Director for Grey County Social Services. I have been here working with the County of Grey for 29 years, a variety of roles, but for the last 12 plus now, I've been in the Director Chair. And we've certainly seen a huge shift in how we have to approach the services we provide in this last year. I still have a hard time thinking it's been a year already, and yet it feels like a long time. It's time standing still but flying. It's a paradox. And I'd like to introduce an OW manager, Elizabeth Brims. Elizabeth, could you identify yourself and provide a bit of background?
Hi, I'm Elizabeth Brims. I've been with the county now in the role of Ontario Works Manager for 2 years. And prior to that, I worked in social services at another region.
Welcome to both of you. I did read the information that you sent ahead. Thank you very much. Although I must say, I think I'm getting older. The print is getting smaller, one or the other. What really captured me, though, if I can just quote Todd Smith, the quote, Ontario's social assistance programs play a key role in supporting Ontarians in need. Programs like Ontario Works and the Ontario Disability Support Program, ODSP, are critical to helping those who have lost their jobs or are unable to work. But the system itself faces challenges that limit our ability to help people get back on their feet. The COVID-19 pandemic has exacerbated these challenges. So that's why you're here, to talk about the challenges and what can be done about them. So where do you go from here?
Okay, well, perhaps what I'll do is speak a little bit to some of the circumstances that we were in here at Social Services prior to the pandemic. So we provide social assistance and children's services from those programs are delivered by staff from within our programs. We have footprints here in Owen Sound at the main county building. We have satellite locations that we serve from in Durham, Hanover, Markdale, Meaford, an itinerant site in Dundalk, and then we have an early on program that is established in Hanover at the flagship location, but we also support the early on programs throughout the County of Grey. And further, we deliver children's services programs and subsidy to established service providers, so childcare centers, as well as we manage the home childcare program throughout the County of Grey. So we are a dynamic and busy group. When we first had some thoughts on what this might look like as COVID was starting to be spoken to, we were having some fortunate things happen at that time. We were undergoing some modernization within our own world for programming, for process, just opportunities that we were taking advantage of without having an idea that they would become so very important in how we deliver our programs. So maybe at this point, I'll just invite Elizabeth to speak a little bit to some of the modernization that we did have underway at the time.
So what had started prior to the pandemic, one of the initiatives was something called My Benefits. So previously, anyone that was receiving assistance, everything was paper-based for them. They would have to come to the office. They would have to be in person. They would have to drop off lots of papers. What has happened under the My Benefits initiative is it's all online. And you can access your account no different than if we want to look at our banking information, if we want to order from Amazon. Society is 24/7, and My Benefits has allowed social assistance to be 24/7. So clients were no longer required to submit any kind of paperwork in person. They could do it online. They could very easily access the information about their benefit payment, when it would be received, and the amount. They could also receive information about what was outstanding, what they still needed to do. So that was something that started before and came in super handy when that first lockdown happened and everything had to close. That was a critical way that we were able to support people. In terms of our own initiatives at the county building, we're completely dependent upon computers for our work. And we were still working on desktops. That was a traditional way that Ontario Works was delivered. And right prior to this, we started moving to laptops. That allowed our staff to be flexible, to be able to safely work from home, to be able to continue to deliver service. So even though our doors were closed, with technology, we've still been able to connect in with staff, to meet with them virtually, to speak with them to connect with our partners. Other technologies such as three-way conferencing. So when we work very closely with our partners at the Y and with Y Employment in particular, we can have a Y Employment support person, our caseworker, and our client all on the phone at the same time. Previously, that would have been, setting up potentially a meeting and people having to drive or get a ride. This has given us the flexibility in this interesting time to continue to deliver those services, not only to deliver those services, but to do it in a coordinated manner. We've also had some other changes come along through the service we're undergoing now, something called centralized intake. So for those that don't know, there's 47 different social services offices across Ontario. That meant, in many cases, 47 different ways of applying for social assistance. And it could be confusing for individuals, especially here where we work so closely with our counterparts in Bruce County. That border is an invisible border. It's only on paper. So for individuals that were going across that border, it could be very confusing if we had different ways of applying. Through centralized intake, there is an 1-800 number and a digital application, again, available 24/7, the application, and 7 days a week for clients to apply, and they all apply the same way across the province. And it goes into one centralized, hence central intake review. In some cases, the first benefit will be issued faster than it would be if it was processed through our own offices. However, if there are unique or special circumstances for someone, they will be referred to the local office, and we will still be there to help them. So it's not an either or, it's a together. And that initiative makes it faster, better, easier for individuals to apply.
We hear of businesses pivoting to cope, but you pivoted as well when in the service delivery. You had some of it already in development or initiation, but it sounds like there's been a significant pivot. What are your clients saying about this? What are you hearing back from people?
So we think that we are serving better, Carol. We know that Elizabeth just mentioned transportation is a huge barrier for a lot of our recipients. And historically, people would have an appointment booked. They'd have to try and find a way to get there. You're completely dependent on someone or somehow to find a way to get to where you need to go. We have implemented these systems so that we can provide virtual support. We don't need people to sign papers the way they used to. We can do a verbal consent. We have a text program for those that are able to receive messaging from us. We help to support them by providing the tools so that they can receive information from us. We know that there is always going to be a population, though, that really does need that additional support. And that's why, as Elizabeth wanted to stress, we will still always be available. We will still, I shouldn't say always, here we are with our doors closed. Depends on what state of emergency we're in provincially, but we definitely don't, we don't put a pause on our service. We're just finding another way to do it.
One of the things that's really interesting, Carol, is for our clients, those that are single, the lockdowns, as you can imagine, are very, very difficult. Mm-hmm. We have a team of 5 wraparound workers whose sole focus is to provide intensive case supports. They have been reaching out throughout all of this and in contact with the clients, in particular those who are alone. Those folks have said categorically that without our support, it would have been a very difficult period in time. We were sometimes the only voice on the end of the phone, the only person calling. And through that service, we've been able to connect people with lots of tools to keep them going. Yeah. For example, for clients that didn't have a computer, we have partnered with an organization called RCT that offers refurbished computers, laptops or desktops. It has to be done through an agency. So we have provided, in 2020, we provided almost 200 laptops and computers to people, that opened the world to them. Because as you mentioned, it wasn't just us pivoting, it was everyone. Everyone was becoming that much more digital. So that was a service where we were really able to connect people in.
Having the centralized referral, like the intake now, so that if you need to refer to other agencies, everyone works from that same intake correct? Like,
Yeah,
what would
everyone
be
has the same info.
So a centralized intake occurs, and you mentioned some wraparound services, but what other services would you be able to assist people with? Maybe you can clarify a bit about what you offer.
So in addition to financial services, which is our first for folks in crisis financially, we also work with a number of agencies in the community. So the Y on housing and employment. We work with the 4-County Labor Board on retraining and skills development. We also offer some very specific services that are available just through Grey County OW. For example, we have a food hamper program for our clientele that if they are experiencing challenges, we can give them that short-term relief while connecting them to other services in their community. We do have the program that's known as our transportation program, where we have been able to help clients get to critical medical appointments. And this service is only available to our clientele, but we have provided not only transportation to them to get to those medical services, but we've also worked with our agencies to get supplies to individuals. Yeah. So when some of our community partners, the United Way has done a great job around the area of supports and food provision for individuals who are food insecure. We are able to use our services to bring that all together.
Excellent. Now, before I lose track of this, your transformation is just beginning, right? I mean, I can ask more details about services later, but I want to hear, there's more. You've got more planned in your transformation. So maybe you can sort of talk about next steps and what you anticipate will come in the future.
Sure. So we've been talking about our pivots and our transformation through the COVID lens, but on a larger scale, there's a social assistance transformation happening across the province. And that does include both the ODSP and the Ontario Works programs. There will still be benefits under both of those programs, but how they'll get delivered in the future will look different from how they're delivered today. So the province has been working with us in the last couple of years, speaking and using language like removing the administration burden. And when we speak administration burden, it is heavy. We've been paper-based, we've been process-based, when what we know works and what really helps is relationships and trust engagements, face-to-face, getting to know one another. Clients really flourish with that support of someone who understands and can be their connector. Elizabeth spoke to the fact that we've got this wraparound model internally now in advance of this provincial transformation, where we're going to be looking at and currently are using life stabilization techniques. We've adopted processes that really reach a deeper engagement with the people we serve. We're meeting them where they're at. And so that's a big change for both us as delivery agents, and it's a big change for our clients as well. So we're looking at some change management strategies. It's a bit of an ambitious schedule over the coming 18 months. I believe we'll be sitting here in 2 years really looking at a very different program, but I'm very hopeful that it's going to improve the services and really impact that social determinants of health, that quality of life that our clients so need from us.
How will you measure how effective this is? So that there's obviously a strategy in place, and I did have how much time because I saw it divided in sections, but you're thinking over maybe an 18-month period, right? That thing. How will you know if it's achieved what you hope it will? How will you know, looking back, that you thought it would and it did?
So I'm going to pass this one to Elizabeth. I think we can speak data points. We can talk about caseload size and decrease in our Ontario Works dependency on our caseload, lots of things, but it's really that qualitative piece that I think we're really going to be looking forward to.
So part of what we'll do there will definitely be measurements in terms of client surveys and actually asking the clientele how we did. and how they feel about the service. We will also have the information that we continuously gather. We get lots of notes of thanks, emails of thanks, personal thanks from clients, so that is that point as well. We will also, from the ministry, have certain benchmarks that we have to meet. So we are hoping that the time that, for example, from when someone applies for Ontario Works till they receive their first benefit, that should be around 4 days. So we will be measured to see if we are meeting that as a target. Our caseload, for example, how long people are on the caseload, how quickly they move to the next step, which is not always employment, because sometimes retraining has to happen. Sometimes health issues have to be addressed. All those things will be measured. It's no longer sort of a when did you start and when did you leave, but all those steps in between will be part of that evaluation, that the client is moving forward to whatever goal is set. And that could be a variety of things. We participated, for example, in a pilot initiative last year called the Social Assistance Mental Health Wellness Initiative. This was online cognitive behavioral therapy for individuals experiencing anxiety or depression, mild, and who were waiting. As we all know, the wait lines for mental health supports are extensive. We were very successful in getting a number of our clients onto that program to test it, to see if it worked, obtaining feedback from that, and then being able to go forward. Those kinds of measurements will be key.
I know we've talked about COVID-19. Are you getting more referrals? Are we are concerned about the number of people who are now either precarious work or they're just not able to have enough money. Are you seeing an increase in the demands on your services?
If I could speak, sorry, Barb. I was going to talk.
No, you go right ahead, Elizabeth.
About emergency assistance. So something that social assistance offers is something called emergency assistance. It's for people who are in a temporary crisis. Prior to the pandemic, in the year before, we received 14 applications for emergency assistance. Last year, 200.
Wow.
So that tells you, and that's just Grey County, right? We can only take applications from the people in Grey. We are seeing the numbers this year, January, February, and March. They're holding with the same. So March of 2019, we received 14 applications. This year, we've got 19 in March. So folks, the pandemic has caused issue for the working poor. We've all seen, I'm sure yourself, you go into a grocery store, you're looking at the price of food. Food, when you're on a tight budget, is the one thing that is expendable because you can eat less. You can't pay less rent. You can't pay less utilities. Mm-hmm. So we are seeing an increase in demand for supports for food insecure individuals. We've definitely seen an increase in demand for those kinds of services.
Carol, I would also add that we are unaware, or we don't have the statistics that we need to understand what the impact of CERB and the CRB benefits and the sick benefits are like in our communities. We've been requesting them, but they haven't been provided as yet. We know there's a false floor out there. We know there are people who are without jobs, won't be going back to those jobs because those jobs aren't there anymore, but they're currently receiving the federal recovery benefit. And so with the withdrawal of that, we are planning to determine how we will handle that, because we know that there'll be folks that have to come through our doors when there isn't an opportunity for them. On the flip side of that, we are preparing as well for the skills and the training and the opportunities that are here with the hundreds of unmet job needs that are out there. Employers have been very forthcoming and indicating that they really are they're struggling to fill these vacancies. The trouble is the match, right? The match between who's not working and what the skill sets are for the vacant positions. So that's some work that my management team has been doing with 4 County Labor Board and our partners at the Y Employment to look carefully at how we can build programs that will match and move people through that continuum to become sustainable in a new circumstance, in a new environment, in a new kind of job.
So, we think of COVID as ending. but it's not business as usual as soon as the doors open. And what you're describing is almost a need for planning and transition as a recovery, because there is that adjustment around employment and just income and food supply. And it sounds like you're planning for that recovery based on the information that you're getting. So where the transformation is in process, you've already had the chance to make some changes. What would be the barriers that would stall you? How do you keep this kind of transformation happening when you have all these other demands upon you?
One of the things that we're very fortunate that this government is doing with us is engagement. This is an iterative process. So as we move forward with the prototypes, there are two things happening. There are small prototypes working right now for an employment transformation. So some municipalities, a small group, I think there's 9 municipalities involved in 3 regions, and they're working the bugs out, if you will. They're moving forward with a defined line, a timeline, to find out how this works on the ground. Because we all know a plan is only as good as it's written on paper. Implementation is where it really gets real. And so there has been some great work going on for the last many months. I'm going to say 6 to 8 months as those have moved forward, and that will then in turn influence the rest of the province. That's one piece. This centralized intake piece, as Elizabeth mentioned, that we're currently we just went live. Was it Monday, Elizabeth, that our team went live?
It's Monday.
Monday. And so here we are Thursday, and this is what happens. We're just constantly in a state of change, but we're no different than our parties around the province in various sectors, all sectors. We're all going through some change. We won't ever be where we were prior to COVID, right? We won't. And regardless of whether we were in a social assistance transformation or not, COVID has impacted our business forever. It's allowing us to take a step back and look at what's necessary, what are the important pieces, and what can we not do anymore? Right? It allows for that, not that status quo. We won't be doing that just because we always did it that way. We're now really looking at each and every process to determine its impact and value. The great part for us is that we have a staff team that's very dedicated to that life stabilization component. There is a huge benefit to working with someone and improving their quality of life. And so it's a reciprocal arrangement. Basically, if I know that I can help someone, then my efforts that I put into this are strong and they're receiving. And so you know, it's a celebration along that continuum for both the client and their worker.
Absolutely. So we have about 1.5 minutes. Elizabeth, do you have any closing words that you'd like to share? I can't believe the time's gone so quickly.
I think that it's important for folks to know that we are here to help. That you can always call us, and we work with so many people in the community. It really takes a village. So we're not doing this on our own. The strength of the partners that we have, combined with the knowledge, the skills, and the dedication of our staff, we really can make a difference in someone's life, and that is our goal. We are working hard to make it happen.
Excellent. It certainly sounds like, although COVID has had so many negative implications, that around the social assistance programs and the transformation, there is a silver lining as you're moving forward in what you're going to be able to do to support and stabilize individuals to be successful. I want to thank both of you for being on the program. It's been absolutely delightful to do this interview with you. Please come back and give us more information as you move through this transformation. That's an open invitation, so please come back. Thank you as well to our viewing audience for joining us today. Please join us again to learn more about services programs available to you and to your family. Take care, stay safe, care for each other. Thank you.